Welcome to Healthcare Today. Ankle sprain is a very common injury, and most of the time this injury is get neglected by ourselves because there is a common belief that it's a very simple injury and we need not to take any healthcare advices or medical advice for this injury, and we just try to ignore it and thinks that it will heal by its own, but it's not true. Like other injury, ankle sprain, basically it's a ligament injury, is similarly grievous injury like a fracture of the bone. If we don't get proper attention for proper healing, it can cause some consequential severe post-trauma effect or any other complication of the ankle joint. What happens when ankle sprain happens? So while we are walking, usually our common tendency to put our steps on the outer surface of the bone. So there is a common tendency that when you putting our foot on the outer surface, it tends to move inwards, and our body reflex, they stabilize the ankle and keep it in its position, don't let it move extremely inwards. If somehow while walking we step into a ditch or any hole, then due to this awkward position it goes into a internal movement, extreme movement, and ankle sprain happens. Or if while walking we miscalculate the steps, that means while getting down from the stairs we thought that there is no stairs there, we reached the destination, but there is another step there, so we miss the height and suddenly we keep the foot down, and due to this miscalculation our brain is not ready to balance the muscles around the ankle, they fail to keep its stability and the ankle moves inside. When the ankle moves inside beyond its limit, then the ligaments on the outer sides, they get stressed out, and the first ligament to tear is that from fibula to talus, the ATFL. So the most commonly in ankle injury, this area gets swollen up and become painful, tender. So which area will get injured depend on, while getting this inversion of the inner movement of the ankle, in which position our foot is. If it is more flat, then this area will get injured. If our foot is more like inclined, then more distal area, usually this area will get injured, not the ankle. So commonly in ankle sprain, the most common injury is the ligament here in the ankle. Other than this, there is a bone fracture happens here, the fifth metatarsal base, or the tendon that passes behind this ankle joint, the peroneal tendon, they also get injured. So thinking that ankle injury is very simple and we don't need any special medical attention, and if we ignore and think that it will heal by own, then we may miss lot of this injury and can suffer with the consequences. So don't ignore if you had an ankle sprain. Visit your orthopedic surgeon or a foot and ankle specialist surgeon for proper evaluation. Earlier, for the ankle sprain we used to give plaster, but now the concept has changed. We don't give any plasters and we try to mobilize the ankle as early as possible. That means we immobilize the ankle partially and at the same time we try to move it earlier. That helps in reducing the pain, swelling and stiffness. So the physical therapy, that means rehab exercises, they are very important in recovery of the ankle sprain. If you don't start it early, our ankle can get stiffened, the ligament and muscles, they can become weak, and the possibility of repeat sprain get more in the consequence time. So if you have ankle sprain, don't immobilize it too much. So initial few days put some ice, take painkillers, and restrict your movement to reduce the acute pain. When the acute pain is subsided, in next week, try to mobilize it with the movements with the help of the physiotherapist and improve the muscle coordination and muscle power. This is the common treatment protocol of ankle sprain nowadays. I hope this video will help you out understanding the importance of ankle sprain and importance of taking adequate treatment and immediate medical attention for ankle sprain. If you think this video is informative, please do like, share and subscribe our channel. We care for you.